mental health to some extent is familiar to all of you. So I invite all of you to actively participate in the session so that we can have a fruitful session for the carrying out of a number of activities when you start working with your students later on. So with this brief introduction, let me start sharing with my presentation. I hope the screen is visible to all of you.
Yes, madam.
Yes, madam. Visible.
Yes, madam.
Okay. So the
Yes, madam.
topic for today is women and mental health. And of course, it is for 2 sessions, that is from 10 a.m. to 11:15 and 11:45 to 1 p.m. I will try to strictly adhere to the timing provided by MMTTC. If we have any doubts, I will share my email ID also at the end of the second session. So if you have anything to ask or anything to discuss or know more about it, you are welcome to send me an email. So let us start with the first session. So the flow of presentation for my session is like this for both session 1 and 2. First, we will start with what is health and what is mental health. And then we cover to some extent a brief touching upon what is mental illness, magnitude and its impact, types of mental illness, treatment and rehabilitation. But please note that this is not a major session on mental health. We are covering mental health and women issues in particular. So this is only a brief introduction so that you are aware of that aspect of mental health also. Then we start with women and mental illness, vulnerabilities of women due to gender, then stress and mental health, coping with stress, that is as applicable in personal and professional life, scope for intervention with student population as we are all teachers, and then how do we nurture our mental health. So these are the topics that are going to be covered in the next few hours. So let me start with something you are all familiar with. So I want you to quickly type in the chat box, what do you understand by the term mental health in one word or a sentence? I will be watching the chat box now. So can you just start doing that? In the chat box, please, everyone start typing. What do you understand by mental health? What is your understanding of mental health? Please put the message in the chat box. We have 2 minutes for this activity. A state of mindfulness, somebody has written. Thank you for being the first respondent. Mental health equals overall well-being of individuals. Okay. Emotional well-being. Right, madam. Thank you. State of well-being. Yes. By the way, anybody from psychology background here? refers to physical, mental stability and overall health of a person. Yes, nice one. Handle stress effectively. Yes, Meenakshi madam. Mental health is a state of person's emotions. Okay, thank you, Dr. Usha. Resilience, says Dr. Shabina Baker. Thank you, madam. Others, please. You can type in Kannada also. I can read Kannada, but not other languages, other Indian languages. Mental health is stress relief. Right, sir. Right, madam. State of balancing multitasks. Nice one, Dr. Jyoti. Yeah. Mental health is a peace of mind. Yeah, Manoj, sir. ಸಮಚಿತ್ತದ ಮಾನಸಿಕ ಸ್ಥಿತಿ. Shobha madam, thank you. Equilibrium. Samachitta. Okay, thank you for your responses. Let us now see what the WHO tells about mental health and health. It's all what you have shared is covered in the WHO definition. That is what I feel. And it has added a few more perspectives in a scientifically, systematically balanced way. So let us look at that definition. So the WHO, World Health Organization, in 1948 first talked about health as a total composite state of physical, mental, and social well-being, and not merely an absence of disease or infirmity. So this was the first definition where WHO, World Health Organization, recognized that health is not a single component, that is physical illness. Usually, when we talk about health, when somebody asks you, how are you? We only look at our physical health, not the other aspects of health. But WHO clearly said that health is not just physical health, it has two other components, that is mental and social well being. And we can proudly say that we added, rather, India added one more aspect of health to this definition later, and they added spiritual health also as part of overall health. So, health comprises of all the four components: physical, mental, social, and spiritual health. And here again, the WHO, see, it took till 2004 to come up with the definition of mental health. Okay, so mental health is considered as a state of well being in which the individual realizes his or her own abilities, the capabilities. They can cope with normal stresses of life. They can work productively and fruitfully, and they are able to make contribution to his or her community. So here the WHO recognizes four important tasks which are important for keeping one's mental health. The first one being the abilities of the individual or capabilities which are recognized by the individual himself. That means not suffering from inferiority, not wondering about whether I will be a failure, but understanding the abilities and taking up tasks according to their own abilities. Secondly, to cope with normal stress which happens in life. So, life is not a smooth sailing boat. in an ocean. It is completely unpredictable. So, under those unpredictable circumstances, a number of challenges arise. And how an individual copes with those challenges is what we need to look at when we are talking about mental health. And thirdly, the person may have the ability, the person may be able to cope with stress. But if the person does not make use of it to be productive and be satisfied and being a contributing member in terms of financial, physical, and other types of services, what he can do to his family, himself, and being independent. That is what is also important to be a healthy, mentally healthy person. And fourth one is ability to make a contribution to his or her community. So, the social aspect of mind is covered in this definition. So, mental health, as you have said, resilience, equilibrium, ability to cope with stress, ability to manage emotions, and being able to take up tasks and make it completed in a productive way and satisfying way. All those things come under these four components. So when we ask a person, are you healthy? It should also include mental health, and the mental health includes these four aspects. So we can finally say that mental health is a term used to describe either a level of cognitive or emotional well-being or an absence of mental disorder. So these are the things that are important, cognitive and emotional. Cognitive means thought process or thinking process. So a balance between our thinking and emotions and also our behavior and absence of mental disorder. So this is how we define the term mental health. Now, when we talk of health, the definition also mentions absence of illness. So, absence of illness means what? What is mental illness? That is what we need to see. And why we need to worry about mental health also is because the statistics say clearly that 1%, minimum 1% of population all over the world suffers from major mental illnesses. I will cover about what are the types of mental illness in my next slide. So just know that serious mental disorders are part of the population about which most of us may be aware, may not be aware. An estimated 10 to 12% of our population suffers from minor mental illnesses such as anxiety, depression, alcohol, and drug abuse. So these are some of the commonest, mental illnesses which come under minor mental illness categories. And like, for example, cough, cold, and fever, which is considered as a common physical illness. Likewise, nowadays we can clearly see that anxiety, depression, alcohol, and drug abuse are considered as minor mental illnesses. Then we have 15 to 20% of outpatients who are visiting general practitioners. That means those who go to general doctors complaining of physical illness symptoms, they suffer from diseases or ailments related to mental or psychological origin. That means imagine out of 100 patients going to a doctor for physical checkup, they actually a 20% of them, that is 20 of them, may be having physical symptoms originating from psychological factors. So this shows how far the mental illness affects the people, though it is rarely recognized. That is why we say mental illness is invisible, unreported group of illnesses due to fear of stigma and lack of awareness. These are the two major hurdles in recognizing and duly giving treatment for mentally ill people. Now, I want to ask you people to speak, okay? Not write in the chat box. So few of you, I will ask at least 5 people to respond to this. What are the common myths about mental illness? Myths means wrong notions. Okay. So what are the common wrong notions about mental illness? Quickly, some of you unmute and then start speaking.
It is not curable.
It is not curable. Yes, madam. Thank you. Thanks for that response. That is right. Most people think that mental illness is not curable.
Not curable.
Yes. Somebody else, please. Quickly. What are the wrong notions that are there about mental illness?
So the people will hesitate to share their mental illness related to mental illness.
Yeah. Why is that? Why is that hesitation? That is why what
They
are
feel
the
like it is some
misconceptions?
abnormal state.
Yes, it is an abnormal stage, but why do they fear disclosing it to anyone? What is the reason behind it? What misconception or wrong notion they have about mental illness, which makes them to hesitate? For example, if I have a physical illness, I don't hesitate. I just go to seek treatment. So why do they hesitate? Because of these myths. So I want to know how much you know about these myths about mental illness. Others?
Commonly it is like in a people say that it's a kind of a devil possession. If this person starts behaving isolated or not talking, not having a normal activity, they think they think that okay, something has happened to him, and it is connected. They connect with the god, and they connect with the other practices, like devil possession is there. So because of that reason, the person is behaving. This is the
Yeah,
common
this is
myth,
common. Yeah,
common myth.
thank you, thank you. So this is one of the commonest myths. When we see abnormal behavior, the first thing they will think of is something supernatural, possession by evil spirits. You all have heard of it, I'm sure of it. Right? So what they want to do is go to the faith healer, thinking that some evil spirit has possessed the individual. And if you commonly see in the rural areas, they visit Datta Mandirs for seeking relief from the possession that the individual is going through. So that is one of the reasons why they don't come seeking treatment from a psychiatrist, but rather they would go to the faith healer, thinking that it is related to some black magic or evil spirit or possession. Yes, thank you. And any other? I'm sure you have heard of a number of myths. Please say it out loud. There is no right or wrong in this. Every area will have some type of unique belief about why mental illness occurs. Quickly. We have a lot of things to cover and very limited time. What, this group doesn't know anything about mental illness? Or you know everything and so you don't want to talk about it? Is everyone following what or how the discussion is going on? Am I understandable?
Yes, ma'am. Yes.
Okay, then why no participation?
Ma'am, underestimate by themselves.
Underestimation by?
By themselves.
Okay, they hesitate because they don't know what they are going through, so they are not able to seek help. Yes, that can be one of the reasons. Yes, and then two more responses, please. Yeah, sir, I didn't hear you clearly.
Inferiority.
Hello?
Inferiority, madam.
Inferiority. Okay, yeah. By the patient, yes.
Yeah.
But what happens to the family? Why does it not seek the help from others?
Social isolation, madam.
Social
Family.
isolation, fear of social isolation.
Yeah,
Yes,
fear of
that is
social
a possibility. Yes. Then, anyone? I was looking for 5 responses before I proceed. So last chance for somebody to speak out. Yes?
Madam, comparative marking.
ಮೇಡಮ್ ಅಷ್ಟು ಕ್ಲಿಯರ್ ಆಗಿ ಕೇಳಿಸ್ತಿಲ್ಲ.
One.
Hello. All right. So, Madam, poor network, I think we are not able to hear you. All right. Let me talk about some of
mental
the...
Okay, ma'am. Mental health affects only the adults, not the children's, not the ರೈತರ
Yes.
ಮಕ್ಕಳಿಗೆ ಆಗೋದೇ ಇಲ್ಲ ಅಂತ ಹೇಳಿ.
ಹೌದು, which is a very wrong notion. Mental illness can affect both children, adults, and senior citizens. You are right, madam. That's a very wrong notion. So now, when we commonly look at myths about mental illness, some of them, like already quoted, are the first thing is magico-religious beliefs that evil spirits, black magic causes mental illness. The second is the fear of stigma. Stigma means what? People will isolate us socially. People will keep us away, which is true also. If you look at families of the mentally ill, many a times the parents come to us, used to come to us in demands and request, Madam, please keep my son or daughter in the closed ward for 2 months or 3 months because we want to marry off the other son or daughter who is normal. As long as this person is there at home, nobody will marry my son or daughter. So that is the reason why people want to avoid getting the label of mental illness, because the third misconception is that mental illness has no cure. So because of this fear, they are not able to seek help. And fourthly, some people associate mental illness episodes with the cycles of the moon. They say on new moon day or full moon day for Amavasya and Paurnami, usually the Amavasya. Like yesterday was Mahalaya. So on Amavasya or somewhere near to the Amavasya day, mental illness is triggered or it increases, and they associate that with seizures also. Fits and mental illness, they are not same, but people think that when people have fits, it is equivalent to mental illness, which is again wrong. Similarly, mental retardation, which is actually a developmental delay or handicap. People equate mental retardation with mental illness, which are totally different identities. So some of these myths actually cause a lot of delay in seeking treatment, whereas early detection and early treatment initiation are the key to curing the mental illness. So these myths hamper the process if you are in your workplace and you are doing some other activity, please mute yourself so that it does not affect the session. Thank you. So these myths and misconceptions cause a lot of problem in providing treatment to the mental illness. And what happens because of the mental illness? Productivity of the person is lost, quality of life is lost, chronic suffering is there if they don't take treatment at the right time, and they continue to suffer from mental illness. Their families are seriously affected, and the burden of care is there, and disability affected life years. Please remember, note down that mental illness, severe mental illness causes handicap. As in physical handicap, mental handicap is also there. And for that, there is a number of facilities provided through Disabilities Act also. So the person who is having major mental illness can make use of the benefits of Persons with Disabilities Act. But in spite of knowing all this, the people who can actually reach out to seek treatment are still a minuscule portion compared to the people who are actually suffering in the community. Now let us briefly look at what are the types of mental illness. Broadly, we say mental illness are divided into some of these categories. One is major mental illness. Major mental illness has two types, that is schizophrenia and bipolar affective disorder. These two disorders can cause severe disability to an individual. Schizophrenia is considered as a thought disorder and bipolar affective disorder is a mood disorder. That means the person has happy mood and very sad mood. Both moods or the emotions will affect the way the individual functions. And schizophrenia is a thought disorder. They think that people around them are trying to poison them. They are going to harm them. And in this type of delusion, this is called as delusion. Or sometimes they hear voices when there is nobody present. So that is called auditory hallucination. So hallucinations and delusions make the patient to act out in an abnormal manner. They will be talking to themselves, they will be laughing to themselves, they might be crying to themselves, they might be acting out their fears also. That is, they might try to attack somebody thinking that they are trying to harm them. So there is these are some of the features, observable features we can see in major mental illnesses. And then we also have a group of illnesses called minor mental illnesses. Under these, we get anxiety, minor depression, or we call it as neurotic depression also, phobia, obsessive compulsive disorder. Some of these disorders, which are basically related to anxiety in an individual, they are called minor mental illnesses. Then we have a category of illnesses called substance abuse. Substance can be anything, like for example, tobacco, alcohol, drugs, and under that a variety of drugs also will come. So those which are not taken for health reasons, rather for getting a kick out of it, that is called as a substance abuse. Substance abuse can further increase to substance addiction, like addiction to alcohol and addiction to drugs. So there are a number of drugs, both synthetic drugs as well as those which are available in natural form, like ganja or tobacco also. Tobacco leaf can be chewed. Tobacco can be inhaled also as snuff, or it can be smoked also. So some of them are synthetic drugs which are there, which have been manufactured. Every couple of days you will hear that the narcotics department has seized drugs worth this many crores from international airports, or ganja is being confiscated from some groups of people. So all those are substances which can give an altered state of mind, which can provide pleasure temporarily, but it can also make the person highly dependent on that drug for continued effect. So that will cause addiction, and addiction causes major problem for the individual and the family. Then we have psychophysiological disorders. Psychophysiological, like I said in the when I talked about magnitude of mental illness, that at least 20% of patients who come to general doctors actually suffer from not physical disorder but psychological disorders which are camouflaged as physical disorders. Whereas psychosocial or psychophysiological disorders are a group of disorders like anorexia nervosa, bulimia nervosa, or insomnia, that is lack of sleep, not able to get sleep. These are some of the disorders, and psychosexual disorders. So inability to have uh, erection or premature ejaculation, or not getting a sexually satisfying partnership. So some of these can be part of psychophysiological disorders also. Then we have a group of disorders called personality disorders. That means the individual's personality makeup is something like antisocial personality, obsessive compulsive personality, neurotic personality. So they have certain traits which continue with them lifelong, and they reach an extent, such an extent, that it is not possible for other people to live conducively with them. So that is when it is classified as personality disorders. Like one of the madams said earlier, disorders in children and adolescents. No, she mentioned rightly that children, they feel that mental illness is only an illness of the adults, not the children. No, children have a number of, exhibit a number of psychological or psychiatric illnesses. They can be developmental, or they can be learning related, or they can be purely psychiatric. That means developmental means we can consider as autism, pervasive developmental disorder, it is called Asperger's syndrome, or mental retardation. And when we talk about learning disabilities, disabilities in reading, writing, and arithmetic, these three are majorly found in children. Early detection is the key to remedial education. That is the way to treat the children who have learning disabilities. Then in psychiatric illnesses, children can have selective stuttering, selective mutism. And see, sometimes stuttering is related to some physiological problem. But many a times, children start stuttering when they get scared. Like when they go to the school, and if they are afraid of the teacher, they may start stuttering. Or school refusal, or enuresis encorporesis. That is, passing urine in the bed itself while there is good bladder control. Like 10-year-old child who is already been bed trained. He, after starting a new school, he or she may start wetting the bed, which is not natural. Again, maybe due to some psychological fears and anxieties. So likewise, children can have these type of uh, symptoms when they present to the psychiatrist, or they can have also the next group of disorders, not disorders, development related issue like mental retardation. Under mental retardation, we have mild mental retardation, moderate, severe, and profound. 4 classification is made, and borderline intelligence. So based on the IQ assessment, we will be able to categorize into whether the person has average intelligence, or above average intelligence, or genius. Or on the other side, we have borderline intelligence, mild retardation, moderate retardation, severe and profound retardation. So these are some of the types. I have not covered every one of these disorders, but just to give a broad outline to you so that you are familiar with the terms related to mental illness. But what you need to carry home, the message from this slide, is that there are mental illnesses of different types. Like how we have physical illness, we also have types in mental illness. Cancer is different from heart disease. Heart disease is different from lung disease. Lung disease is different from orthopedic issues, right? Likewise, in major mental illness also, schizophrenia is different from mood disorder. minor mental illness. Anxiety is different from phobia. Phobia is different from panic attack. Panic attack is different from obsessive compulsive disorder. And they are all different from, minor depression. So substance abuse also has a number of varieties. Psychophysiological disorders are totally different. Personality disorders are another group which are not related to any of these. So there are varieties of mental illnesses, and there is a need to appropriately diagnose, like how we diagnose the physical illness. First, we go to a physician to find out what specialist I need to go to for, rightly identifying the disease. Then only treatment can start. Likewise, in mental illness also, we need to identify the right disease to be able to give right treatment. Now, we need to also look at why does a person get mental illness. Now, in terms of major mental illness, first and foremost thing that plays a role is heredity. That is, it can get transmitted from affected parents to their children, especially schizophrenia and manic depressive psychosis. And the personality of the individual also. Some people are what we call as type A personality disorder. They actually are prone to heart attacks, which is a physical disease. Similarly, there are some persons who are prone to becoming extremely anxious by nature, that is, by their personality, or they are very introverted. I don't say introversion as a disease. Introversion is not a disease, but some of those traits, personality features, they make the individual to brood within themselves rather than share their difficulties. So that can cause at a later stage, when the person feels overwhelmed by the inner thought process, they may lead to a psychological breakdown. And then environmental factors. This is a very, very important and controllable factor in mental illness, because we can't control the heredity except when, if both parents are having mental illness and they do a attend a genetic counseling to see what are the chances of my child inheriting this disease. And if they find that there is high chance of child inheriting the disease, then they may decide to not have the children of their own, but to adopt. I have seen 2-3 couples who have adopted children because they know that genetically their children are vulnerable to getting a mental illness. Both parents, they had mental illness, and it was a marriage among cousins also. So the family and the extended family decided that they should not have biological children, and they went for adoption. So this is something can be possible. Genetic counseling to parents who are suffering from mental illness. They can marry, there is no doubt, but whether they can have children, whether they should have children, is something that they need to think of. But when it comes to environmental factors, we have studies have clearly demonstrated that conducive environment, positive environment fosters positive health as well as mental health. Whereas a negatively loaded environment, for example, lower socio-economic strata, poor housing, poor caring, and very fully surrounded by antisocial elements with no support for growth, no support for education. Under such circumstances, children are, they are pushed into antisocial elements from a very exposure to antisocial elements can cause a very negative impact on the way the child develops itself and how the child continues to grow as an adult. So this way, similarly, the various pressures that happen in and around an individual. Like, for example, parents asking for high academic achievement in children, which may not be in the capacity of the child because of the level of intelligence. Then that pressure can cause a lot of adjustment issues, which may later develop into anxiety or depression. Commonly, we see, a number of cases of suicides after 10th result, 12th result, or, graduation also. Even from, institutions such as IITs and medical colleges. Students studying in third year medicine committing suicide. Students in IIT graduation level students committing suicide, which is, very, very surprising as well as shocking considering their level of intelligence. So it is not related to intelligence at all. It is not related to the physical situation at all, but it is related to the psychological makeup of the individual as well as the environmental pressure and expectations about their own self as well as the environment. So these aspects make it very difficult for the individual to cope with the situation which is presented to them, and that constant stress makes them to go for these drastic measures of ending their life, which is very, very sad. Similarly, if you look at under the broadest spectrum of mental illness, crimes also indicate poor psychological health of the society. The more number of crimes mean that poor social health becomes, very much part of the society when the individuals are not adhering to certain codes of conduct. And why does that happen? Because their psychological mind as well as the environmental factors, they are not conducive to a positive social participation. So these are the factors which affect an individual into developing a psychological disorder. Now, let us briefly talk about intervention, because as teachers, you need to be aware of this. Number first is that identification of mental illness and treatment with empathy. That is the key to recovery. We have seen cases living within 1 kilometer radius of Nimhans for 20 years, suffering from major mental illness, not coming for treatment. Sometimes we read in newspapers that the mentally ill person has been tied to a pole with an iron chain and left the whole day, when the caregiver goes out to earn money to feed this person as well as herself for livelihood. And the caregivers are depicted as, villains who have chained the mentally ill. Of course, it is very, very wrong. It is illegal to chain a mentally ill person. But if they are so poor that if this lady or gentleman doesn't go out to work, they don't have anything to feed for themselves. If that is the level of poverty that they have, then what option does that person have? Will anybody take care of this mentally ill person when the other person has gone out for, earning a living for themselves? No, nobody will come and take care of a mentally ill person. Even in physical illness, caregiving is so difficult. So under these circumstances, what options are there? But we have seen a number of affluent families also, because of this fear of stigma about mental illness, they have kept the mentally ill under lock and key for years together. Sometimes the greed of property, a relative or a group of relatives, sometimes their own brothers and sisters have locked up mentally ill patients. So that type of exploitation also is reported. So we need to look at the situations, but the key to treatment and getting cure for mental illness is detecting it early and providing treatment early. And mostly second important thing is supportive environment. And the supportive environment should also include medicines, giving medicines on time, education about the illness, that is called psychoeducation to the family. Most importantly, counseling, family therapy, group therapy, and support groups, depending on what is the requirement of the individual. And most importantly, for major mental illnesses, we need to have rehabilitation. That is how we have rehabilitation centers for physical handicap. We must have rehabilitation centers for psychiatric illness also. And two other important factors are attitude of the family towards mental illness and the index patient. That should be always evaluated and intervention should be made. Studies have clearly shown that family support is the one buffer factor which can help a mentally ill patient from going for relapses or frequently getting the illness back. But if the family support is not there, if the family is very critical of the person or over involved with the person, these are called as expressed emotions in psychiatric parlance. So these type of being critical towards a patient, being over involved with the patient, or not showing interest at all about the patient, any of this can cause the person to get into frequent relapse of the mental illness. So attitude of the family is very, very important. And most importantly, whenever a family is taking care of mentally ill person, what is the impact of the stress on the person? As I have worked in the field of rehabilitation of mentally ill, I have seen senior citizens who are caregivers to mentally ill patients. Chronic mentally ill, I am talking about them. Minor mental illness, they don't require rehabilitation. They can, with counseling and therapy, psychotherapy, they can go back to being themselves in the society without having any major problem. But major mental illness, they have disability, and when they have the disability, it is very important that the rehabilitation is given to them, and it has to be done in the community with the support from the immediate family. But senior parents who are not able to take care of the children, but they have nobody else who is going to take care of the person. So the patient may be 35, 40 years old. The parents may be around 70, 72. They have their own physical illnesses. But, and siblings will be far away. They cannot take care of this mentally ill person. And they have so much of stress and they are not able to physically handle this person. Sometimes if the patient becomes aggressive, then what will they do? A 72-year-old father cannot handle a 40-year-old aggressive son. Sometimes you need 2, 3 people to control that person. Then what will they do? So the impact of stress on these senior citizens, their caregivers. Once we had a wife coming and crying about the patient. He doesn't care about anything. He dirties everything. If I have cooked food for 3 people, he eats everything by himself and then leaves everything empty and goes away. My daughter comes from school hungry and there is nothing to eat because whatever I have cooked has been eaten up by this person. So this causes me extreme stress. I don't know how to avoid this. I don't know what to do about it. I have nobody else to support. His own family members do not give support. So this type of situation needs to be assessed and community level resources have to be mobilized to provide treatment. So this is in brief about mental illness and treatment. Now let us look at the um, uh, impact of environmental factors on women and why it is important to look at women and mental health. Now, when we look at issues related to women, of course, you would have heard about it from a number of sessions. About 50 million people get affected by violent conflicts, if we say, on an average, per year. About 80% of the affected people are women and children. Let us look at Gaza. Let us look at Ukraine-Russia war. Let us look at a number of conflicts happening in Africa, where the rebels attack the schools and kidnap the young girls and take them as slaves and go away. So, civil wars, disasters, displacements. Now, when I talk about disaster, of course, you have heard about Afghanistan earthquake, right? Very recent happening. A number of people are affected, and it is in a very, very bad situation. I read a report about, women stuck under the rubble of the earthquake. Their rescuers go there, they see the women, but they can't pull them out because the Taliban law forbids a man from holding a woman's hand other than his wife or mother. So these women are stuck in the rubble of the earthquake. They are not able to extricate themselves from there. But the rescue operation people are watching them, but they cannot pull them out because the Taliban rule says a man cannot touch a woman, a strange woman, unknown woman. Look how the situation is in the disaster, how it has led to that, and displacement of women and children. So this is one of the major reasons why the women get seriously affected by psychological stress and obviously illness. Lifetime prevalence rate of violence against women ranges from 16% to 50%. And at least 1 in 5 women suffer rape or attempted rape in their lifetime. And what is the impact of this violence? Exposure to violence gives rise to a type of psychological disorder, psychiatric disorder called as post-traumatic stress disorder. You may have read about many war veterans, that is, people who are exposed to wars, coming back from the war and suffering from what we call as flashback about the violence that they have seen, the bomb blast in which they have lost their fellow soldiers, or cut arms, limbs, and the screams of the people, the bomb blasts and its effect keep on coming back to them, and they are not able to reintegrate themselves in with the society. So post-traumatic stress disorder we see commonly in women who are affected by these type of extreme violence. Then depressive disorders. Close to 41.9% of disability from neuropsychiatric disorders is occurring in women when we compare to 29%, 3% of men. So women have a higher rate of depressive disorders. And leading mental health problems of women, of adults and senior citizens is depression, organic brain syndrome, and dementia. And majority of these disorders are seen in women. Now, you may have heard in the earlier sessions that women live longer than men. So the longer they live, the morbidity is also high. So that can also be a factor there. But whatever is that factor also, then even then the number of women who are affected by these factors are quite high compared to those who are the men in general. So women have higher risk for mental illness as well as stress due to physical violence. So these are the factors which make us to take up this chapter or this session in the session on gender. Now, other things that we need to look at is when women fall ill, what happens? Most of the time, treatment is not at all taken, or they take home remedy, or they ignore it till it cannot be ignored anymore. And women's treatment is one of the last, considerations in a household, because the woman has to take care of others rather than, others taking care of the woman. So generally it so happens. This is so even in cancer patients also. If you look at it, men get any physical illness, men immediately get attention when they fall sick, or when they require treatment, or when they are shown some symptoms of not being able to manage things on their own due to some physical problem. So under those circumstances, males get higher priority in attending to healthcare, whereas women are not given that priority. So these are some of the things that definitely affect the way, and if a woman is mentally ill, it is even worse. What happens is she is led to wander off. If she is married, husband's family immediately sends her back to her home, maternal home. And in the maternal home, there is nobody to care for her. Nobody wants her, neither the matrimonial home nor the maternal home. So under those circumstances, she becomes easily a wandering, mentally ill woman who can be physically, sexually, assaulted, leading to pregnancies, unwanted pregnancies. One of the NGOs in Mysore, we have seen rescuing young women who are mentally ill and already 7 or 8 months pregnant. She doesn't know who has exploited her. She is not able to recall what is the condition, and already the child is growing inside her. And when she delivers the child, she may not be able to look after the child also. So these are some of the situations that we see with regard to prevalence of mental illness and hurdles to treatment among women. So with this, I want to take a brief stop. If you have any questions, doubts or clarifications,